and respected Dr. G.S. Rao garu, and the guests who are on the dais, and IRMA members and my fellow doctors. It's a privilege to be on this stage and also to be a part of this IRA conference today in Telangana, especially in Yashoda hospitals. Because I have to tell first about Yashoda hospitals. It is one of a kind, not just in the country but in the entire world. And it has been competing with the topmost hospitals in the world. And G.S. Rao garu, I think looking at this Yashoda hospital, every corner of this hospital reflects his hard work, and also it is visible that he has put heart and soul into this Yashoda and healthcare system. And I'm sorry to say, when I was a postgraduate student, I used to think they used to invite politicians to the conference. I used to think, politicians అసలు హెల్త్ కేర్ గురించి ఏం తెలుసు, ఎందుకు పిలుస్తారు వాళ్ళను అని. But today, as a radiologist, I am glad that I've coming into the conference. And then let me tell you that it's just a short speech. First of all, the healthcare system, especially in our country, has made transformative changes. Especially the digital healthcare system, ecosystem, which is there, has created a benchmark. And also the private public partnership or interoperability or the strong data governance, what we have today, is at the core. And also, we have become a model for most of the developing countries, where India is seen as a model, and most of the developing countries that are striving for a better healthcare system are looking at India today. And now our healthcare, the quality healthcare we are giving is no more a privilege, but it's the right of our people in the country. So, not to mention that our government has been looking into the healthcare system by encouraging the primary health care, and also putting a lot of efforts into vaccination drives, or investing into national health mission, or also into the imaging centers that are coming up now in every district at block level. There are many Ayushman Bharat like schemes like Ayushman Bharat that has come up, which is the world's biggest health insurance system, and where about 55 crore members have been there into this Ayushman Bharat. All these resulted in increase in the public-private partnership, and has encouraged both private and also government sector. And not to mention also the many schemes which we have been taking up, like every district level we need an imaging center. So this has created a lot of teleradiology also. And the not to tell that the market, which the radiology market that is growing in our country, which was about 9.56 billion US dollar in 2022, will be about 17.56 in the coming years. We have grown this far. And also, this not only the schemes, but we have all heard about the last budget, when the finance minister spoke about the life-saving drugs, where the custom duty was waived off, and also the X-ray machines, where there was reduced custom duty, and on the X-ray tubes and flat panel detectors. This encouraged the local manufacturing. It is nothing but to boost the manufacturing units locally. And also one of the reason would be it would cut down the cost of our equipment, and also the CMC and AMC we were bearing. Me as a radiologist, I had my own diagnostic center, and I know I used to feel then there should be someone to represent us, to tell my problems, because my problems are not heard, my problems are not solved. So here I am like a representative. I want to represent as a consultative member. I am a consultative member in the education committee. I am the standing committee member in the health and also PCPNDT. I am the member in the national PCPNDT also. So it has actually, to be frank, sir, I've attended many conferences. Radiologists come to me with PCP and NT problems, but there is no such presentation. That is lacking. That is what I felt. So if we all come together with a presentation, I think I can become the voice in the center, and I will definitely do the justice. Because the first standing committee of health I was sitting at, the first thing I've taken up is about the PCPNDT, where the non-locals, the non-radiologists were taking up this PCPNDT. That was my first concern, and I've raised this concern in the health committee. But I need this from your side also. So that is a request from my side. And to conclude my discussion here, I'm definitely, as a radiologist, as a member of parliament, I would be on your side. I would definitely stand with you. And I know the PCPNDT, what we are suffering about the PCPNDT, and I'm sure I'm going to get some uniform national license rules in radiology, especially PCPNDT, and let us all doctors come together and work for a Vikasit Bharat, for healthier India. Thank you.